Hi, my name is Lindsay Cardiel, and my project proposal is on nursing burnout. So, nursing burnout is a critical and increasing prevalent issue within healthcare settings characterized by emotional exhaustion, depersonalization, and a diminished sense of personal accomplishment among nurses. This phenomenon not only affects the mental and physical well-being of nurses, but also has significant implications for patient safety, quality of care, and overall healthcare outcomes. High levels of burnout contribute to increased staff turnover, reduced job satisfaction, and compromised patient care, making it a pressing concern for healthcare institutions. This evidence-based practice project proposal aims to address nursing burnout through the implementation of targeted interventions designed to support nurse well-being, reduce occupational stress, and improve retention and patient outcomes. My PICO question is, in registered nurses working in acute care settings, how does the implementation of mindfulness-based stress reduction programs compared to non-formal stress management interventions affect burnout levels and patient safety outcomes within 6 months? So nurse burnout has emerged as a persistent and complex issue affecting both clinical outcomes and workforce retention in healthcare. Burnout not only compromises the quality of patient care, but also undermines nurses' psychological well-being, leading to increased turnover, absenteeism, and diminished job satisfaction. As such, developing targeted, evidence-based interventions are essential. To Socrates identified and examined risk factors contributing to nurse burnout, categorizing them into individual, interpersonal, and organizational domains. High workload, poor nurse to patient ratios, lack of managerial support, and emotional labor were cited as major stressors. The review emphasized the need for systemic changes in work environment and staffing policies to address the root cause of burnout rather than treating the symptoms. This comprehensive perspective lays the groundwork for the multi-level interventional planning. So, to increase the nurse reported job satisfaction scores by at least 15% within 2 months following completion of a multi-model stress management intervention. This will be measured using a validated instrument such as the Nursing Work Index or an established nursing job satisfaction scale to ensure the results are both reliable and comparable with existing data. The Nursing Work Index revised will be used to assess job satisfaction. The Nursing Work Index evaluates domains such as nurse autonomy, control over the work environment, nurse-physician relationships, and organizational support factors correlated with job satisfaction and burnout reduction. This 15% improvement benchmark is both ambitious and evidence-formed. So this evidence-based practice project will follow a project approach using the Johns Hopkins evidence-based practice model. The JAH and EBP model was selected for its structured step-by-step format that facilitates the transition of best evidence into clinical practice and supports collaborative change within healthcare settings. This model is particularly suitable for addressing complex clinical issues like nurse burnout because it emphasizes both the use for high-quality evidence and the engagement of stakeholders in the change process. This project was selected over traditional research designs such as experimental or observational studies because the goal is not to generate new generalizable knowledge, but to apply existing evidence to improve clinical practice. The JAN EBP model's flexible and collaborative framework is well suited for this type of practice change, particularly in real-world healthcare environments while stakeholders' engagement, organizational readiness, and contextual relevance are critical. The Maslow burnout intervention will be the primary tool for assessing burnout, measuring the dimensions of emotional exhaustion, depersonalization, and personal accomplishment. This tool is widely validated and used in healthcare research in addition to the job satisfaction survey. Will be used to assess workplace satisfaction, and a brief customized feedback survey will be developed to evaluate nurses' perceptions of their interventions, usefulness, and feasibility. These outcomes were selected based on their alignment in previous studies that demonstrated the efficiency of AI support tools, mindfulness training, and peer support in reducing burnout and enhancing nurse engagement. Quantitative data will be analyzed using descriptive and inferential statistics. Pre and post intervention scores for the MBI and JSS will be compared using paired t-tests to evaluate changes over time. Descriptive statistics, means, standard deviations, and frequencies will summarize demographic data and participant feedback. So, the proposed intervention to address nursing burnout is a multimodal stress management program comprising AI-assisted personalization support, mindfulness-based stress reduction, and leadership-facilitated peer support sessions. This intervention is grounded in current evidence and aligns with best practice guidance for improving nurse well-being and reducing burnout. AI-assisted tailored support has decreased emotional exhaustion and depersonalization. Mindfulness-based stress reduction decreases stress and increases emotional regulation. So integrating the artificial intelligence into burnout interventions offers promising potential to personalize care for nurses. MSBR programs have gained widespread recognition for their ability to reduce stress, improve emotional regulation, and enhance overall well-being in healthcare professionals. Studies have shown that nurses who engage in mindfulness practices experience significantly lower levels of burnout, especially in terms of emotional exhaustion and psychological distress. MBSR typically involves guided meditation, breathing exercises, and body awareness sessions that help nurses cultivate present moment awareness and resilience by the workplace stressors. These programs are not only cost effective, but also align well with the holistic principles of nursing care. To evaluate the effectiveness of the proposed multi-model intervention to reduce nurse burnout, this evidence-based practice project will utilize a mixed method data collection approach, combining quantitative surveys with qualitative feedback to provide a comprehensive assessment of outcomes. Quantitative data will be collected using the following validated survey instruments, such as the MBI. This tool will serve as the primary measure of burnout. It assesses the subscales, emotional exhaustion, depersonalization, and personal accomplishment. The MBI has been widely used in nurse burnout research and offers high validity and reliability. Additionally, participants will be informed that they may withdraw from the project at any time without penalty, given the sensitive nature of the topic. Resources such as employee assistance programs will be made available for any nurse experiencing distress during the project. The implementation of the proposed multi-model stress management program is anticipated to yield substantial improvements in the nurse's well-being, patient outcomes, and overall healthcare delivery. This evidence-based intervention integrates mindfulness-based stress reduction, MBSR sessions, structured peer support groups, and an AI-assisted emotional tracking tool to address nurse burnout from both individual and systemic perspectives. The program is designed not only to mitigate emotional exhaustion, but also to enhance nurses' sense of support, control, and job satisfaction. But by promoting healthier coping mechanisms and fostering a supportive work environment, intervention is expected to lead to significant reductions in burnout systems, including emotional exhaustion and depersonalization. So, in conclusion, by implementing this project, the facility will not only support the mental health of its nursing workforce, but also contribute to better patient outcomes, higher staff retention, and improved morale. In sum, this project is not only justified by the literature, but urgently needed for the sustainability of both nursing practice and safe, effective patient care. And here are my references. Thank you.